Hello friends, welcome back to my YouTube channel. My name is Mohammad Sohil and today we are going to start new topic that is osteoporosis and arthritis. So what is osteoporosis? Osteoporosis is one of the bone disease that develops when bone mineral density or simply saying bone mass decrease that increase the risk of fracture. It is also called bone brittle disease in which bone are more prone to fracture. Now, what are the symptoms of osteoporosis? Osteoporosis is a silent disease, and typically, you do not have the symptoms, and you may even not know until you break your bone. First, severe back pain, second, loss of height, third, spine malfunction or stooped or hunched posture, that is kyphosis. Then bone affected with osteoporosis become so fragile that fracture may occur as a result of a minor fall, normal stress or even cough. Then last is stooped posture. As you can see, this diagram show all the condition. Then what are the causes? Most common in the post-menopausal women between the age of 45 to 55 years and older than men. In postmenopausal women, due to reduced level of estrogen, it leads to more bone resorption than formation. Estrogen have anabolic effect on bone and play important role in growth and maturation of bone. Reduce intestinal calcium transport. Then certain medication lead to this condition. Example PPI, decrease absorption of calcium from the gastrointestinal tract. Then cancer medicine. Immunosuppressive drugs are also reason for this. Then smoking, chronic alcohol consumption, and last is lazy lifestyle and restricted locomotion. So these are the causes of osteoporosis. Now coming to the risk factor. First, age, second, body size, third, family history, fourth, hormone changes, example lowering of sex hormone, 6 lifestyle, 7 diet contribute majorly, and then last is certain medication and medical history. Now what is the treatment for treating osteoporosis? There is no proper cure but treatment available to slow down the progression. First, osteoporosis due to reduced estrogen can be treated with estrogen. However, estrogen therapy may increase the chances of breast cancer, and that's why reduce enthusiasm for this therapy. Then second, biophosphonates. These are potent inhibitor of bone resorption and increase bone density. It include alendronates, risdronates, ibandronates, and zoledronates. Then third is SERM, that is selective estrogen receptor modulators. It have been developed that prevent the increased risk of breast and uterine cancer associated with estrogen therapy while maintaining the benefit to bones. Then fourth, to counter the intestinal calcium transport hindrance associated with osteoporosis, and vitamin D therapy is often used in combo with calcium supplementation. Then fifth is teriparatide, then six calcitonin, seven denosumab, and last is strontium ranelate. So these are the treatment include in osteoporosis. Now coming to second, arthritis. Inflammation, tenderness, or swelling of one or more joints is called arthritis. Osteoarthritis, that is wear and tear on the joint, and rheumatoid arthritis, that is autoimmune disease, are the two most common types of this arthritis. Symptoms. Specific symptoms vary depending on the type of arthritis, but usually include joint pain and stiffness, typically worsen the age. Inflammation in and around the joint, decreased mobility and quality of life, weakness and muscle wasting, warm red skin or affected joint. Now coming to causes of arthritis. Different type of arthritis have different cause. For example, gout is due to abnormal metabolism, too much uric acid in the blood, but for other types of arthritis, the exact cause is unknown. You may develop arthritis if you have family history of arthritis, unhealthy body weight, joint injury, repetitive stress on joint, and increased age, that is osteoarthritis. Have certain autoimmune disease or some viral diseases like rheumatoid arthritis. Now coming to diagnosis. Laboratory tests, that is analyzing different body fluid, example blood, urine or joint fluid, that can help pinpoint the type of arthritis. Then X-ray, CT scan, MRI, ultrasound for more detailed cross sectional view of joint and to find out the bone density and any breakage to bone or cartilage. These are the diagnosis parameter. Treatment include therapy like physical therapy, exercise can improve the range of motion and strengthen joints. In some cases, splints and braces may also be used. Now, very important, that is medication. Autoimmune diseases in general cannot be cured in many cases, but can control the overactive immune response or bring down the inflammation and at least reduce the pain. Treatment focus on the relieving symptoms and improve joint function. First, NSAID, that is non-steroidal anti-inflammatory drug. It includes aspirin, ibuprofen, naproxen, coxib derivative, diclofenac, piroxicam, etc. Then second, counter irritant like ointment cream containing methanol. Rubbing them interfere with pain transmission signals. Then third, steroids such as prednisone may be given as pill or can be injected directly into the joints. Then fourth, DMARD may slow the progression of disease and save joint from permanent damage. Now, role of pharmacy for managing this. A pharmacist can play his role by counseling patient to deal with this condition by asking him to improve his diet by eating nutritious food, having vitamin D and calcium and other crucial supplements and avoiding junk. Then to do regular exercise and enhancing physical activities. Then to avoid taking immunosuppressive drug without doctor prescription. Then calcium supplement should be given to the aging women especially. Then last is lifestyle should be modified and upgraded. So this is the role of pharmacist.